Okay, so my name is Dave Pyne. I'm a registered physical therapist, and like Joe said, I'm practicing in the Bridge Clinic here in Pyne. Now, first of all, you might say to yourselves, what the hell has a physical therapist got to do with migraine? And I suppose the first thing is I'll just tell you a story, basically. So about, I'd say 7-8 years ago, this young carpenter came into me. He was, 26, 27 years of age, young family, working hard. And he used to say to me, the reason I'm here, he says, is because I've got this wicked pain in my shoulder, you see. And so I said, okay, look, I took a full history of him, and we worked on the shoulder. And as we were walking, he said to me, he says, I'm also suffering terrible migraines for the last, 7 or 8 years, and I'm on medication for the last 2 years. And I kind of didn't take that much notice of it at the time. So we kind of worked on 4 or 5 sessions, and we kind of teased out his muscles and loosened them up. And he came back then about a month later for kind of maintenance work, and he says, "Geez, Dave, by the way," he says, "my migraines, they're not half as bad as they used to be." So that got me thinking, and I said, well, yeah, okay, we'll keep going here, because I wasn't sure. It was uncharted territory for me. So he kept coming for about 1 or 2 more visits, and lo and behold, his migraines had practically ceased. He had stopped taking the medication, and he said his life had completely changed, because he used to spend the weekend practically in bed. So that's kind of the angle I'm coming at. Maybe stress and muscle tension is your trigger. So often people ask me, what is a physical therapist? A physical therapist is, we work on the musculoskeletal system. The musculoskeletal system is basically your muscles and your bones and your tendons. My philosophy anyway is, what I try to do with my patients is I try to get, not only do I treat the symptom, but I try to get to the cause of their pain. What is actually happening? What is going wrong? What is the dysfunction that's causing them to have these problems? Rather than just coming in, treating the problem, and go away, I'll see you next week or whatever. And that is really where I like to come from. Physical therapy is a hands-on approach to musculoskeletal problems and conditions using soft tissue techniques. I explained musculoskeletal problems. Soft tissue is basically muscles, tendons, ligaments, fascia. Okay? And techniques, hone palpatory skills. What we in the institute where I trained, we very much concentrated on learning what it is you're feeling with your hands. So you can only tell so much by special tests and range of motion tests and that type of thing. It's actually when you put the hands on body that you actually discover. It might even lead you somewhere else. Like in Rory's story, I started on the shoulder, but I ended up back up in the back of his head, releasing lots of tissue up here. And I think that probably had more of a beneficial effect for him than his actual shoulder problem that he had just overused. The techniques I used then are complemented using trigger point dry needling, ultrasound, and electrotherapy. You might have heard of ultrasound and electrotherapies, but trigger point dry needling, don't mistake the trigger point for being triggers for your migraine. A trigger point is basically, we've all felt them, they're like the little knots that you feel in your tissue. You'll hit it and it'll trigger a response. So that's what if you hear me throughout the presentation saying what trigger points, that's what I'm talking about. It's a knot in the muscle. So, continue on. Okay. One thing we'll go through first of all here is red flags. Red flags are what we in the health profession see as warning signs, or something that could be much more serious. So if you have a headache with any of these conditions, then immediately seek your GP's referral. So headache with stiff neck and fever, headache with numbness and weakness, numbness with altered vision, headaches with confusion, convulsions, or loss of consciousness, any type of head injury, headache with sudden onset of pain, or pain that won't go away, a pain that's been worse than you felt it before. So any of these things, these are red flags. Go to your physician straight away and make sure that you rule out any other serious conditions. Okay, when is a migraine not a migraine? Kind of a question people are going to say. And how I'll answer this to you is, We all know Mick, he's just been out all day and he's after slouching down the couch. And his wife comes over, he says, "What's wrong with you, Mick?" He says, "I've got a terrible migraine and I've got the flu, you know." And he's probably after sneezing twice and he's got a cold. So that's what I mean by sometimes you can what we tend to do is to box things into the worst thing they are, or what they're probably worse, and you're probably saying to it'll go away. So we tend to kind of categorize things as being very, very bad, or sure, it'll be grand, you know, it'll go away. But what you need to do is you need to know if your migraine is a migraine and get it diagnosed first. Now, this is a study that I researched up there. It's done by Bayer Pharmaceuticals in Germany. It was a study carried out in Germany very reputably. And this is people who present to their GP with headache. And actually 53% of the people who present to their GP with headache, it's actually a tension headache. So it's nothing more, nothing nasty or nothing like that. That's what it is, a tension headache. And that you can see in the red slice of that pie chart there. In the yellow part over there, we have 39% are actually diagnosed with migraine. And 8% then are other types of headaches. Tension headache, as you can see in the top right-hand corner, that basically says it's like squeezing, it's like somebody else jumping down the top of your head. So it's a constant pain. It's not that throbbing pain that migraine gives. Aching at the temples, back of head, and neck may also experience pain or pressure. Pain or pressure is felt on both sides of the head. Another giveaway sign. Mild to moderate pain and possible sensitivity to light and sound. Often experienced at times of stress. Again, I'll tell you more about stress later on. Recurring especially during stress-filled periods and duration of 30 minutes to several days. So that's tension headache. This was drawn by a German artist, and I think sometimes a picture tells 1,000 stories. So that really kind of struck me as being as telling what it is that the migraine suffers. The next one then is the cluster headache. Again, it's men. It's that piercing in the eye, you know, not to be confused again with migraines. Okay, researchers found that irritated or inflamed nerves in the neck can refer pain into the face and scalp, causing headache. Nerves can be irritated by four factors. One is the muscle tension or neck stiffness or anything that causes, because you must remember the nerves pass through the muscle tissue to get to where it is one wants to go. So if the muscle is in spasm or it can't function properly, it squeezes on the nerve, and that can refer pain up into the head and neck area. Again, bad posture is another very common feature of it. Lower back pain, that can cause sciatica. Again, similar type thing, runs down the leg. Up in the cervical area, up in the neck, it can trap nerves up there. Again, headache can be caused by viral infections. We've all had the flu. We're aching all over. That's because the virus is attacking the nervous system as well, and that's why you're feeling that pain. And the last one then is Mr. Head the Ball, who's not going to head the ball anymore, but he's going to have a sore head. He'll probably be sore in the back of the head and sore in the front of the head. So, but again, that can cause any types of spasm as well. Okay, occipital neuralgia, running through this quickly again. Tension at the back of the neck muscles, that's the occipital nerve that runs out the back, goes up into the head. Again, anything that causes irritation to this will give you a lot of head pain. The cervigenic headache, that's the cervical, that's those neck vertebrae up there. If they're degenerated, if they're wear and tear, if you have any conditions, again, they can become out of alignment and they can pinch on the nerve as well. Sinus headache, again, your man on the couch, deep and constant pain in the cheekbones, forehead, bridge of nose, intensifies with sudden movements or straining, and accompanied by nasal discharge and fevers. So again, not to be mistaken for migraines.